off stage.
Been to some of y'all's meetings before, but I now have a 7-month-old grandbaby who I call the Chunky Monkey. And I keep them on Wednesdays now, so I have not been able to join y'all, so I miss being here. But anyway, yeah, I tuned into one of y'all's Zoom calls, recorded classes before. I know y'all had CPR people here before, and one of y'all asked, do we get to practice? And I'm like, that's what I can do. I'll show up and I'll bring my man and see y'all can practice. So today, like you said, we are not going, this is not a certification class. This is just to introduce you to CPR if you have not done it before. If you cannot get on the floor, I'll be glad to put the mannequin on the table. I don't know how that'll work. But you know, in real life, if something happened, your person's gonna be on the floor and you're gonna have to get down on the floor, right? Okay, so what we're gonna do, the first step, I break CPR down into steps. First step is you see somebody down. So is that the next slide? You see somebody down, you need to assess to make sure the scene is safe. So if, you know, that person is down on the ground because they stepped on something and got electrocuted, I see them and I run to go help them, and then I step on it, now I'm down, right? And of course, we have a crazy world today where things can happen. So we want to make sure there's no danger and the scene is safe before we go cross. All right, so our next slide shows, so what we're gonna do, and they are really, American Heart Association is really trying to push CPR on females too. So they are coming out with mannequins that are female. So it's not just the guys. So I'm gonna say, hey, are you okay? And see if he responds to me. So if there's nothing medically wrong with him, he should blink or startle or something, right? But if he's not responding at all, there's something medically wrong with him. So we do not know if he needs CPR or not, but there's something wrong. So we're gonna, next, if he doesn't respond, we're gonna call for help. So help, hope somebody will come and help me. If they do come, I'm gonna direct them to call 911 and get the AED, right? So I'm gonna say, Leanne, go call 911. Taylor, go get the AED. So, and if no one comes and I'm by myself, I'm gonna hope I have my phone with me. I'm gonna call 911 myself, put it on speakerphone, and put it next to me. If it's an adult and my phone's in the other room, I'm gonna run and go get my phone and call. So we want that help coming right away, right? So, if we don't have it, go get your phone and the AED yourself. Okay. So now we've got help coming. We're gonna, if he's not breathing, we're gonna stop and see if he's breathing, right? Gotta tell himself. So we're gonna see, does he need CPR? And we figure that out by checking his breathing. If you know how to take a pulse, you can do that too. But in Heart Saver CPR class, we don't teach that. So we look at least 5 seconds, but no more than 10 seconds. 10 seconds is our limit on not everything, because that's when the blood flow really starts not getting to the brain and everything. So we want to limit to 10 seconds. All right, so he's not breathing. So we know we need to start doing compressions. So what we're learning today is called compression only CPR. That's when we're just going to do compressions. Keep that blood flow running to the brain. And we're going to push 2 inches, which should be 1/3 the depth of the chest, on a child or an adult. So 2 inches. And we're going to compress 100 to 120 beats per minute. Everybody know the song?
Staying alive.
Staying alive, right? So bring back your 70s gear and we're gonna. So we don't have to count. If we're doing compression only CPR, we don't have to count. We can sing to ourselves. Do you know what song you don't sing when they're doing CPR? This is my one CPR joke. What? You know it?
Happy birthday. No, another one bites the dust.
Someone likes it. Right, so staying alive, 120 beats per minute, 2 inches, 1/3 the depth of chest. Now, if you were to do the best CPR, I guess you could go ahead and click to the next one. All right. So if you're doing the best CPR, we would want to give breaths. And if it's your loved one, you know, if it's a stranger and you don't know them, like, I'm not putting my mouth on that. You would do compression only CPR, right? But if it's your loved one, you want to do compressions and breathing. And that's what you're gonna get when you take a CPR class. And we'll talk briefly about it if we have time. I'd love to go over everything, but for today, I wanna make sure you can do compressions. So we're gonna put our hands in the center of his chest. Right here's a little bitty bone, hypoxychoid process that will crack and break off, puncture a lung. We do not want to be down here. We want to be in the center of the chest. We're going to put one hand on top of the other. We want our shoulders. I do babysitter classes with CPR, and these are some of my little teenage girls that did a great job. You want your shoulders over your hands. You want your elbows straight. So we're wanting gravity to help us do this because this is exhausting. It really is. So if somebody comes and says, I can help, you want to trade out so you won't get exhausted. So I'm going to put him down on the floor. All right, Cena safe. Hey, are you okay? Are you okay? He does not respond. You call 911, you get the AED. I check breathing. He is not breathing, so I'm going to start my compressions. So I've got my shoulder straight over. If I go right speed and the right depth, I'll get 2 green lights over here on the shoulders. So that's another great reason why you want that CPR class, so you can get the feeling of what it feels like. Because most people don't have very blinky lights. But if you go too fast, it's going to start blinking yellow. That means slow down. If we're going too fast, we're not giving the heart time to refill with blood before we smush it again, right? The medical term. So, that's why you don't want to go too fast. So if whoever wants to come down and try, come on down and I'll watch. And I'll be glad after everybody's got down, anybody else cannot or does not want to get down on
It's just work with people who have arms and legs.
Yes.
Leave it to Mark.
Yes.
They're not taking clear the valve.
What?
They're not taking, they're not taking clear the valve, make sure. Not something in the valve.
Yeah, but we're not.
How do you know that they're not choking?
Hmm?
How do you know that they're just?
They are choking. If they're not breathing, we're supposed to do
Good.
CPR. When we do breathing, we check their mouth and we do see something they pull it out. I know you.
Yeah.
Doing it. I got it. Anybody else wants to come down?
Oh.
Okay,
Right here.
there's one more.
Yeah. that'll be-
We got one more spot if anybody wants to come down. Okay, so put your hand in the center of the chest, perfect. The other hand on top. Now bring your shoulders over. Yeah, your arms are gonna be straight. And now we're gonna, ready? Just start pushing,
How many
see what we
times?
get. Huh?
How many times?
You're gonna get, we're just gonna keep going. All right, go a little faster. There we go. Good, you got it. Keep going. Good.
Well, that's good.
Stay.
Yeah.
There you go. Now, go.
Have you taken this
Deeper
class?
and faster.
Yeah, see, feels good.
Now, if I told you you have green lights, you can keep going or you can stop. It's up to you. All right, go deeper. 1, 2, 3, 4, 5, 6. You stop
How you
for
holding
just a
up,
second.
Stevie?
Okay.
All right,
You got it,
break.
you got it.
You can tag team.
Oh, no.
You just killed it.
Then in there, no.
Okay. I'll
What,
do it.
Nick? Yeah, good. No, good.
Right.
At least we can try and see it.
Good, right off. the
Hey,
bat.
Kitty, I'm proud of you.
Okay, lay down, Tim, I'm trying.
I know. It's like, oh, no, I'm good. Hey, I'm breathing. Yeah.
Little too fast, Miss Lynn.
Got it, A plus, A plus.
And then don't lift your hands.
Alright, bring your hands up a little bit on the center of his chest. There you go. Now bring your
I
shoulders
didn't
up.
bring, I don't.
Right, don't bounce, push. 1, 2,
Come on, let's
3,
go.
4, 7, 8. All right.
You're fine.
The heart is more on the left side. Now push. 1, 2, 3.
There you go, honey.
Go, there you go.
Okay.
Now you can feel secure. That's your favorite.
Oh, my God.
I'm
All right.
You got it. A little faster.
Sylvia, a little too fast. Yeah, Sylvia, too fast. You want to slow it down? Sing your song.
This guy did that hard.
1, 2, 3, 4, 5.
Yeah.
Yeah. So it.
Well,
I'm gonna tell him.
You can't get it right away.
Okay. You did it? Oh my God. I know. Good, you got it. Okay. You did it.
He's dying, I'm dead.
Isn't it? I know.
But it's
It's hard.
Yes, yes.
All right, good job. That's okay.
Come on. No. Wait on that.
He win.
Come on, you just got ratted out.
Thanks, honey.
Right, put your hands in the center, straight in. Now. 1, 2, 3. Now push harder. 5, 6, 7, 8, 9.
There we go.
Okay.
This would be a great incentive class for.
We offered that,
Exactly, yeah.
and I'll do it again.
There you go.
Taylor, it's got it. Oh, look, Troy, if you can't do train, right?
Jeez.
Yep.
Wow.
Oh, my God.
All right, did everybody go that wanted to go?
Wow, that is.
Okay, so, like you can see, it can get tiring really quick. We had a good question. Our goal here is to keep the blood flowing to the brain until the ambulance gets there. That's why it's important to call 911 immediately when we think something's wrong, because we want that help coming as soon as possible. I'm short of breath just from down. Okay, so you're gonna keep going nonstop to keep you will not restart the heart by doing compressions. All we're doing is keeping the blood flow, keeping the blood going to the brain. All right. So you keep doing that. Somebody else comes along, says they can help you, then that's great. All right. So today we're covering compression only CPR, but for, if you take a class, we learned about giving breaths. So we're not going to practice that today, but I am going to show you so you can kind of sort of see it. So to give a breath, we're gonna, we karate chop his forehead, which we really don't. We're just using that and then, so I'm gonna use that to push his head back. And then I'm gonna pinch the nose, because if I don't pinch the nose and I give a breath, what's gonna happen? I'm gonna use the other hand to hold the jawbone. So that way we're opening the airway to give a breath. It's sort of like obstructive sleep apnea. That airway's closed up and you can breathe, nothing's gonna go in. So we gotta open the airway, we give a breath, and his chest will rise. We wanna give 2 breaths in 10 seconds. If you don't get that breath in, let the head go back, try to open the airway again, and try a second breath. If the second breath doesn't go in, 10 seconds is up, go back to compressions. Compressions are more important, okay? So you only get 10 seconds. So, right, so I'm doing 28, 29, 30. What we're doing, if you were to give breaths with your compressions, you're gonna do 30 compressions, 2 breaths. 30 compressions, 2 breaths, okay? So that's how you would break it down if you are adding breathing to your CPR. You're doing compression only, you're not gonna be worried about count, just gonna be compressions. Does that make sense?
Yeah.
So 28, 29, 30, since nobody's sharing with me, I'll put my mouth on.
Oh, my.
Wow. Way to go, Reese. That person's gonna survive.
Can they really physically see that when you blow into their?
That's your goal, is to see. That's right. That is your goal. Okay, so how are we on time?
You've
Okay.
got, sorry, 8 minutes,
Okay,
but you got a little bit longer.
okay, so we'll go ahead and let me make sure I've got covered everything. So we're gonna keep repeating 30 compressions, 2 breaths until somebody, hopefully that ambulance shows up. But what if you are lucky and somebody found that AED and brought it to you? So if that happens, you're gonna stop what you're doing. The AED is gonna shoot electricity across the heart. The heart beats because of electrical signals. So that's our goal, is to shock that heart and get the heart beating again. The compressions aren't gonna do that, only an AED can do it. Now, AED may not shock, there's only 2 rhythms. It's kind of like, the machine's doing an EKG, kind of, sort of, and it can tell what rhythm they're in, and can they have a shock or not? Is a shock gonna help? It may say no shock needed, but we're gonna hope it will, and we can get him back. So somebody brings me an AED, I'm gonna stop what I'm doing and put the AED next to me.
Just stand forward.
Automatic external defibrillator. So I get the AED out and I put it next to me. Now, all AEDs are the same, but they're different based on what brand they are. So some of them will turn on automatically when you open the cage. Some of them you have to turn on, some of them you have to pick. Is it an adult or is it a child? So in our case, he's an adult. So I turn it on and I listen to it and I follow the prompts. If you just calm yourself, take a few deep breaths and listen, the AED is gonna talk you through it, okay? So the first thing I'm gonna do is I'm gonna put it next to me. I do not wanna be reaching across, pushing the shock button. What's gonna happen? I'm gonna be on the floor, right? And then you're gonna be doing CPR on me. So I'm gonna turn it on. If it doesn't turn itself on, this is a toy.
Apply hands to patient's bare chest.
All right, so I'm gonna turn it off so I can talk. But the pads, again, some of the pads will tell you where to put them. Some of them are universal and you can put them either place. So that it goes under the collarbone on the right side. It has to touch the skin. It cannot touch bras or any underwear. This one goes under the left armpit, next to the chest. And what we're doing is we're sending an electrical signal across the heart.
Wow.
Some of them will say, put it in the front, put it in the back. So like I said, all you gotta do is look at the pictures and see what it tells you. And then it's gonna say shot, needed, not needed, and the orange button will blink and you will push the button and shot. But before you do that, you're going to pretend like on your favorite medical drama and say clear and make sure nobody's touching him. Because again, if you're touching him and you push that button, you're down too. Okay? It's happened in the hospital. So anyway, yeah, somebody pushed the button and didn't yell clear, and a nurse was standing, not my hospital, but I can't find out where, they won't tell me, but it's happened somewhere. So on this one, we plug it up. Some you may not need to. All right, so there's your proper AD placement. Under the right collarbone and on the left under the armpit area, okay? So after it shocks, you're gonna go back to doing your compressions. This will stop, the AED will stop and reanalyze every 2 minutes to see if they need to be shocked again. If in 2 minutes, if you're going the right speed, you should get 5 cycles of CPR in. 5 cycles of 30 and 2, 30 and 2, unless you're doing compression only CPR. And we don't worry about the time, we just do compressions, okay? All right, and so that, anyway, when it stops to analyze, to see if he needs to be shocked again, he'll say, clear, analyzing. Somebody had shown up and says, I know CPR, I can help you. That's the perfect time for them to step in, you to take a rest, take it out of expressions. As you can tell, you're gonna get tired in 2 minutes, right? And you don't, giving poor compressions is not good, so we wanna make sure we're doing good compressions. All right, do we have anything else?
That's it.
Does anybody have any questions?
So you'll have to, they'll let you know when that thing seeks to come back off. Once it reads.
Yeah.
So you'll have plenty of time to not touch that bottom.
Do not touch the patient. Analyzing heart rhythm.
Wow.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Charging. Stay clear of patient.
Right, clear,
Deliver shock now.
push the
Touch
button.
the shock delivered. It is safe to touch the patient.
It's gonna give me a beat,
Begin CPR.
and it gives me a beat to get my compressions too. Okay? So that's just a general idea of how they work. Like I said, it may be a little different based on what brand it is, but pretty much the same.
Are there requirements for organizations to have them, like certain companies or,
Mm-mm.
you know, so?
And I can fix you up if you need one. But yeah, I mean, they're supposed to come out with one. I think they're working on it to get FDA approved. That's smaller and like $500 for home use.
Okay.
So, because they typically run around $2,000. So they're working on trying to get one suitable for home use.
Is it true that, like, if you, Lisa always tell our caregiver, once you get 911 on the phone, you're under 911's direction, right? Rather than your own.
So, the 911 dispatchers are supposed to be trained
Right.
that they can help walk you through
Right.
it.
Yeah,
So
especially if
you
you've
know
not
it's
done it before.
CPR,
Yeah.
plus them helping you. If it's my husband,
Yeah.
I'm gonna be freaking out.
Yes.
And everything I've learned has gone out my window.
Right.
And so having them talk to me and say,
Yeah.
okay, start compressions,
Right.
and help me walk through it, that's gonna help. So the knowledge that you get from a CPR class, plus listening to
them,
them, it's
yeah.
gonna be your best. Okay. Yes.
Just a quick story. Troy's best friend was not feeling well, and he said to his wife, I think you need to take me to the emergency room. And thank God she had wisdom to call for an ambulance, 911. They jump-started his heart 17 times.
My God.
And, we said, I asked the doctor one time, why would they be so persistent? He said, if there's just the littlest blip, they will not give up. Now that man's still alive. That was probably 10 years ago?
And then plus, she said, I'm not taking you to emergency room, I'm calling 911. And the people at 911 said, had she taken to the emergency room, would have never made
It
it.
would have been too late. That's
I
true.
had a lady, my mother was in the hospital, and right next door, there was a man that was having a heart attack or whatever, they're trying to get him back. No, maybe not a heart attack, but they're trying to get him back. That man was a big man that was doing it, and I mean to tell you, when he got through, he was covered in sweat.
Yeah.
I bet he worked with him 30 minutes trying to get
Yeah.
him back.
And you're gonna crack ribs when you do, if you're doing
Okay.
compressions only, you're gonna crack ribs. So don't get freaked out. Just expect it. Cracked ribs heal, but stopped hearts don't. So, yeah.
To elaborate on Mary Lou's question, so one thing about, I have a history, CPR certification, so with, when you're calling 911, right, you are underneath their direction, as she said, but getting certified, we fall underneath the Good Samaritan law. So as long as you're acting within the scope of your training, okay, everybody's dude happy, right? want to sue everybody. So if you act within the scope of your training, you're protected.
Yes.
Wow. Well, this has been wonderful. Appreciate everybody participating. He was out of breath. He's looking for tags even. So anyway, thank you. Wonderful job. I got just one real quick story here, talk about, we were at our golf course. Well, we used to have a real young cutie pie.